A Men's Fertility Guide. Chapter 1. Men's Fertility. Infertility for men. The ability to have an erection, orgasm, and ejaculation does not mean that a man is necessarily able to conceive a child. Fertility or infertility has nothing to do with sexual potency. Infertility in men comes down to the inability to produce healthy sperm that will unite with the female embryo/egg to be fertilized to form a baby over the space of the pregnancy. Nature has endowed most men with lots of sperm because the path to the female egg is often a difficult one. Sperm are produced in the testes and travel through the epididymis, where they are stored and nourished. From there, they travel through the ejaculatory duct, known as the vas deferens, and further stored in the seminal vesicles. When sexual arousal and stimulation reaches a climax, it causes contractions in the muscles within the penis, urethra, and prostate gland. This results in semen being propelled through the urethra and out of the tip of penis. If the sperm are healthy and travel through a woman's cervix and uterus into her fallopian tubes, one sperm may fertilize the egg. Men continue to produce sperm irrespective of their age. Exactly how many millions of sperm are needed to guarantee that the female egg will be fertilized is a subjective number different for every man. It's not just number that counts. It's also shape, swimming ability, and rate of development that determine whether the sperm is strong enough to make it. A normal ejaculation contains 250 to 500 million sperm. Sperm count is a standard of how many millions of sperm a man has in 1 cubic centimeter, cc, of semen. A normal fertile sperm count is 20 to 80 million sperm per cc. 20 million sperm per cc is considered the minimal number necessary for fertilization, even though men with lower sperm counts occasionally impregnate their partners. A sperm count below 10 million is considered poor or sterile. A semen analysis is a simple test where the sperm are examined under a microscope to check for number, shape, and movement, motility index. Good swimming sperm have strong tails that allow them to swim effortlessly, but poor swimmers don't, in a condition called asthenospermia. A man goes to the clinic, masturbates in the bathroom, then the sperm are looked at under a microscope. There are several different types of sperm tests. Other tests are X-rays of the sex organs to look for damage, the mucus penetrance test to see whether the sperm can swim through a woman's vaginal fluid, and the hamster egg penetrance assay wherein a man's sperm is tested on hamster eggs to see if they can penetrate them. There is currently an at-home sperm testing kit being developed called the Fertile Mark Kit. Man can produce no sperm, a condition called azoospermia, a problem usually caused by testicular failure due to either viral injuries like mumps or pneumonia or genetic disorders. Obstructive azoospermia is a condition where the testicles produce good sperm but the ducts to get it to the urethra are blocked so it doesn't get there. A condition of too few sperm is oligospermia. In this case, the problem could be defective testicles or a defect in the hormonal system of the body, which starts at the pituitary gland, goes to the hypothalamus and down into the body. The pituitary produces luteinizing hormone, LH, and follicle-stimulating hormone, FSH, and this is related to both testosterone levels and the signals from the testicles in the production of Sertoli cells, sperm, and a protein called inhibin. If any one of these areas are off, brain, testicles, testosterone, good sperm isn't produced. There are two types of oligospermia, testicular, which is primary, and pituitary, which is secondary. If the problem is in the testicles, it could be major. If it's in the hormonal production of the brain, it should be able to be fixed relatively easily. Another type of infertile men produce too many sperm, up to 250 million per cc, in a condition known as polyzoospermia. Pyospermia is a condition where a part of the penis is infected, such as the prostate gland, which causes bacteria and white blood cells to mix with the sperm, thereby nullifying its potency. This condition can be treated with antibiotics to clear the infection up. The doctor might examine the various hormones in the man's body, do a physical examination of the scrotum to check for a possibly varicocele ordo, or rectal ultrasound scan to check the prostate and testes for possible cysts. Alcohol, drugs, and stress are the leading causes of male impotence, although a wide variety of medical conditions could contribute to it. Some other causes of male infertility are psychological, pituitary imbalance, thyroid disease, diabetes, serious illness, adrenal imbalance, diabetes and testicular/seminal damage/injury. There are two basic ways to increase a low sperm count: drugs prescribed by the doctor, testosterone, thyroid hormone, cortisone, or a complete change in lifestyle to healthy living. Infertility in men is often caused by varicocele, an enlarged vein in the testicles. An outpatient procedure called varicocelectomy can tie off this vein so that blood flow can be enhanced. Varicocele surgery is performed on men whose testicles are thought to be good, but they're simply restrained from getting the sperm out for any of a number of minor reasons which can be fixed. To check for possible blockage of the vas deferens, a vasography may be performed. If the vas deferens is not blocked but there are still few or no sperm in the semen, the doctor might do a biopsy of the testicles under local or general anesthesia to see if sperm-producing tissue is present. If the problem is in the brain, such as men with idiopathic hypogonadotropic hypogonadism, doctors simply inject them with hormones that signal the testicles to produce more good, healthy sperm, or prescribe drugs like clomiphene, Clomid, Seraphine. Another cause of infertility is that the man's apparently healthy sperm cannot penetrate the cervical mucus in the woman's vagina. There is a test for this where a few hours after intercourse, the woman comes to the doctor's office. He takes a sample out of her vagina to see if the sperm are swimming in the mucus or not. This condition is called sperm-cervical mucus incompatibility. Studies have shown that men who wear tight underwear or use saunas and hot tubs are raising the temperature of their scrotum to above 104 degrees, which is too hot for sperm to grow. Men's most common threats to fertility are high temperatures like a hot work hour, steel mill, bakery, something like a hot tub, hot shower or sauna, and a lot of exercise which increases body/scrotal temperature. Stressful lifestyle, cold, flu, etc. Lack of sleep, poor eating habits, general illness, weak immune system, mumps, injuries at work or sports in the groin area, long distance cycling, tight underwear, excessive use of alcohol and recreational drugs, STDs, steroid use, radiation, cell phones, color TVs, computers, smoking, exposure to pesticides and other toxins. Based on what I've read, infertility is a very complicated field that has numerous possible causes, some that could be incurable and others that can be treated and fixed. It could be as simple as the testicles being too hot to produce sperm, or as extreme as azoospermia, which is often hopeless. My little report here can't do justice to this complex field which some doctors dedicate their lives to studying. Sterility in men can be due to the testicles getting injured, such as in sports or living a physically active life. Certain chemicals can be toxic to male fertility, like arsenic, mercury, anesthetic gases, benzene, boron, cadmium, carbon disulfide, carbon tetrachloride, chloroprene, formaldehyde, inorganic lead, manganese, methyl chloride, PCBs, pesticides, and organic solvents. Reprotox.com, Reproductive Toxicology Center, toxins that could affect fertility. Other risks are microwaves, radiation, in computers, high-tech equipment, high temperatures, men's fertility and estrogen mimickers. Due to our toxic living standards and the prevalence of chemicals in the environment, the birth of males has dropped every year for the past 30 years. The average Gen Y male has a sperm count that is 50% lower than his father's, and, of the few spermatozoids he does have, 85% of them are genetically damaged. According to Dr. Fernando Marina, fertility expert at Barcelona's Cefer Reproduction Institute, if this trend continues, all men will be infertile within 60 years. Male biological clock/fertility in older men. There is evidence to suggest that the sperm of older men is more infertile than the sperm of younger men, and children conceived by the sperm of older men over 45 have many more birth defects than children conceived by the sperm of younger men. We always thought it was just a woman's eggs that spoiled with age, but men's sperm loses quality with age. Some men get some sperm frozen around middle age so they'll have good sperm if they decide to have kids later. ExtendFertility.com, freeze your eggs or sperm for a later date. MaleBiologicalClock.com. Low sperm count /oligospermia/azoospermia. Sperm are quite small and only make up about 3% of the ejaculated fluid, the other 97% being a fluid manufactured by the prostate gland which shoots out behind the sperm and pushes it into the vagina. The mixture is called semen. The sperm, little living cells, contain your genetic code, and when ejaculated, they have a mind of their own and try to swim upstream through the vagina into the cervix. There are many reasons why a man could have a low sperm count, ranging from genetics to pollution to stress to alcohol to certain medications. You can get sperm count tests done. To do a sperm count, a male goes to a lab, masturbates, and ejaculates into a test tube. A lab tech examines this ejaculate immediately under a microscope to count the number of sperm, to check the sperm's motility and to see whether it is normal or abnormal in some way, like having 2 heads or 2 tails. The standard of infertility is under 60 million sperm per ejaculation. Even though it just takes 1 sperm for conception, you need 20 million sperm per milliliter of ejaculate to fertilize 1 ovum. Because so many are killed by vaginal and uterine substances, then it takes more sperm to kill off these enemy substances, making room for the last few sperm to come in and fertilize the egg. The testicles produce sperm. For maximum production, they must be 5 degrees cooler than the rest of the body. In order to keep the testicles cool, don't wear tight underwear, avoid long stays in a hot tub or sauna, and take care of your health. Generally, the larger they are, the more sperm they produce. The average man supposedly produces 50,000 sperm per minute, 3 million per hour, and for every ejaculation, he shoots off 300 to 500 million sperm, which doesn't seem to make sense mathematically if you are shooting off several missiles a day. When sperm are released into the vagina, many are killed by the vagina's acidy fluids, the rest try to swim into the uterus to attach to an egg, but very few ever make it. It could be the girl's problem. Even if you only produce a few sperm cells, that could be enough provided the other conditions are right. Maybe she's infertile for some reason. The sperm that spot the egg engage in a fierce battle to get into it. They let out a chemical which penetrates the wall of the egg and try to get in. There can only be one winner. The one that breaks through first unites with the 23 chromosomes of the girl's egg. Even if you are impotent, doctors can go into your testicles and extract some sperm to implant artificially into a female egg. Infertility could be caused by a sexually transmitted disease which could damage something in the penis, like the vas, the little tube that goes from the testicles to the urethra. Clomid is a drug that increases sperm count. WernerMD.com/lowspermcount.html. Over-the-counter male fertility tests. Men are getting more infertile, probably due to pollution and chemicals. Sperm Check is an FDA-approved home sperm count screening kit for sale in some drugstores. A man can check to see if his sperm count of good sperm that can fertilize a woman's egg is normal or low. The test was developed by Dr. John Hare of the Center of Cell Biology at the University of Virginia. A normal result means a count of at least 20 million sperm per milliliter. Abnormal sperm shape and genetic defects can cause infertility. Try Walgreens.com and CVS.com. Spermcheck.com. Male fertility websites. Books about infertility are number 616.69 at the library. FertilityHelp.net. WebMD.com. HealthAtos.com. IVF.com. IVF-infertility.co.uk. MALE-infertility.md. Chapter 2. Male infertility websites from DMAS ODP. Male infertility websites. ivf.com/male.html, male infertility information, discusses factors in infertility, diagnosis, treatment, artificial and donor insemination, and nutritional issues. Malefertility.md, malefertility.md, information about male reproductive health, infertility diagnosis, and treatment options. Edited by a specialist located in San Diego. Maleinfertility.com, Center for Male Reproductive Medicine and Microsurgery, at Cornell University Weill Medical College. Provides the most updated information and success rates for vasectomy reversal, no scalpel vasectomy, varicocelectomy, testicular and epididymal sperm retrieval, treatment of obstructive and non-obstructive azoospermia for male infertility. Varicoceles PECIlist.com, Varicocele Specialists, a national directory of physicians expert in varicocele repair and many FAQs about varicocele. Find infertility clinics at dmoz-odp.org/health/reproductive_health/infertility/clinics_and_services. Find your region and click through. U.S. Infertility clinics. dmoz-odp.org/health/reproductive_health/infertility/clinics_North_Americas/United_States. Conceivabilities.com, Conceivabilities, egg donation, donor recruitment, and surrogacy agency. Based in Chicago and Colorado. ArcFertility.com, Advanced Reproductive Care, Inc., National Network of Infertility Specialists. AssistedFertility.org, Assisted Fertility Program, Drive. Marwan M. Sheikh. Details of services, staff biography, and contact details. Locations in Jacksonville, Florida, and Salem, Virginia. CCIVF.com, Cooper Center for In Vitro Fertilization Services, including cryopreservation of embryos. In New Jersey, Pennsylvania, and Delaware regions. CenterForHumanReprod.com, Center for Human Reproduction, Diagnosis, and Treatment of Infertility. Multi-center facility with locations in Tarzana, California, Clearwater, Florida, Newark, Delaware, Chicago, Illinois, Westwood, New Jersey, and New York, New York. FertilityGuide.com, FertilityGuide.com, information on infertility including testing and diagnosis, treatment options, and coping strategies. Also includes listing of U.S. clinics. FertilityProRegistry.com, Fertility Pro Registry Network, U.S. searchable database of clinic. Also provides basic fertility treatment information. Find.honor.com, Egg Donation and Surrogacy Center, agency with locations in Marina del Rey, CA, and Nashville, TN, includes staff biographies and FAQs. GiveF.com, Genetics and IVF Institute, provider of infertility treatment and genetics services. Locations in Fairfax, Virginia, and Gaithersburg, Maryland. HaviaBaby.com, the Share Institute for Reproductive Medicine, education about infertility and recurrent pregnancy loss. Forums, news, FAQ, glossary, and details about clinics across the USA. Infertility's PECIlist.com, Infertility Specialist, Directory of U.S. clinics. Also contains information on infertility. Integramed.com, INTEGrammed America, network of clinics, offering a range of services. MaleInfertilityMDS.com, Male Infertility Specialists, National Directory of Male Infertility Physicians. Includes information on member specialists in each U.S. region. ShadyGroveFertility.com, Shady Grove Fertility Center, Infertility Clinic and IVF Center with locations in Maryland, Virginia and Washington, D.C. SSA-AGENCY.com, Surrogacy Specialists of America, LLC, find out about surrogate, gestational carrier, egg donor, embryo donation and related legal services from this agency with locations in Houston, Dallas, and Atlanta, GA. Chapter 3. Andrology websites from dmoz-odp.org/health/medicine/medical_specialties/andrology. Andropause websites. aaghealth.com, AAG Health and Wellness, hormone replacement therapy clinic specializing in testosterone and human growth hormone treatment for andropause. Anabolicmen.com, Anabolic Men. This is a community of active men who seek out alternative ways to increase their natural testosterone levels to reach optimal performance in life. Androgel.com, Androgel website, provides information about testosterone replacement therapy as well as safety information. Andrology.com/andropause.htm, male menopause, discusses the condition, as well as providing a symptom checklist, causes, treatment options, and suggestions for coping. Centre for Men's Health.co.uk, Centre for Men's Health, London Centre specialising in andropause or male menopause. Doublemenopause.com, Double Menopause, discusses both male and female menopause. EliteMen'sGuide.com/testosterone-replacement-therapy-introduction, Elite Men's Guide Testosterone, provides information on andropause and testosterone replacement benefits and side effects. Reddit.com/r/testosterone/wiki/index, Reddit Testosterone, provides information on testosterone, low testosterone, and testosterone replacement therapy. Renewman.com, Renewman, provides information on andropause as well as treatment options for andropause. Andrology websites. Andrology is defined as the science and medicine dealing with reproductive functions of the male. Andrologia.org, Andrology Online, a bilingual site with andrological information. Andrology.com, Andrology.com, about the center and services provided including impotence, men's health, infertility, andrology, Peyronie's disease, and other related procedures. Andrologyaustralia.org, Andrology Australia, a federal government initiative, provides education and resources to health professionals and the community on male reproductive health issues such as erectile dysfunction, androgen deficiency, testicular cancer and prostate disease. gfmer.ch/guidelines/urologic_and_male_genital_diseases/male_genital_diseases.htm, male genital diseases, free full-text articles by the Geneva Foundation for Medical Education and Research. med.utah.edu/andrology/index.html, Andrology Program, University of Utah, Clinical and Research Andrology Lab devoted to fertility education, infertility treatments, and research in sperm physiology and reproductive function. Urology.gr, Urology and Andrology Infobase, a linked database of urological and andrological thematology. Andrology clinics and practices websites. AIA-ZAVOS.com, Andrology Institute of America, the Institute, together with the Kentucky Center for Reproductive Medicine and IVF, KCRM, provide complete services to infertility couples by evaluating and treating both the male and female partners. Andrology.com/andromeda.htm, Andromeda Andrology Center, Hyderabad, India. Information about India's first andrology center and its offers in the field of impotence and infertility diagnostics and treatment. BruceGilbertMD.com. CaliforniaVasectomyReversal.com, California Vasectomy and Reversal Center, Drive. Edward Karpman, Drive. Edward Karpman offers information regarding success, cost, technique, and alternatives to vasectomy and vasectomy reversals and IVF/ICSI. FertilityCenterLV.com, the Fertility Center of Las Vegas. A center specialized in male and female infertility and in vitro fertilization, provides patient-oriented information. MaleInfertility.com, Center for Male Reproductive Medicine and Microsurgery, at Cornell University Weill Medical College. MaleReproduction.com, Center for Male Reproductive Medicine, Los Angeles, provides diagnosis and treatment of male reproductive problems including impotence, vasectomy reversal, sperm aspiration and varicocele repair. MMHC-ONLINE.com, Minnesota Men's Health Center, St. Paul, provides treatment for male infertility and impotence, also provides vasectomies and microsurgical vasectomy reversals with a refund if sperm is not restored to the ejaculate. uic.edu/com/mcsr/androlab/welcome.htm, Andrology Laboratory, University of Illinois, Chicago. The University Andrology Laboratory provides physicians and their patients with all forms of male infertility testing, as well as operating a patient sperm banking program, a direct/known donor banking program and a donor sperm program. Vasectomyinfo.com, vasectomy reversal, information about vasectomy reversal success rates, procedure details, options, and alternatives. WernerMD.com, Michael Werner, MD, urologist with a private practice in sexual dysfunction and infertility. Male infertility websites. ArcFertility.com, Advanced Reproductive Care, Inc., National Network of Infertility Specialists. AssistedFertility.org, Assisted Fertility Program. CCIVF.com, Cooper Center for In Vitro Fertilization Services, including cryopreservation of embryos. CenterForHumanReprod.com, Center for Human Reproduction, Diagnosis, and Treatment of Infertility. Conceivabilities.com, Conceivabilities. Egg Donation, Donor Recruitment, and Surrogacy Agency. FertilityGuide.com, FertilityGuide.com, information on infertility including testing and diagnosis, treatment options, and coping strategies. FertilityProRegistry.com, Fertility Pro Registry Network, U.S. searchable database of clinic. Find.honor.com, Egg Donation and Surrogacy Center, agency with locations in Marina del Rey, CA, and Nashville, TN, includes staff biographies and FAQs. GiveF.com, Genetics and IVF Institute. Provider of infertility treatment and genetics services. HaviaBaby.com, the Share Institute for Reproductive Medicine, education about infertility and recurrent pregnancy loss. Infertility's PECIList.com, infertility specialist, directory of U.S. clinics. Integramed.com, INTEGrammed America, network of clinics, offering a range of services. MaleInfertilityMDS.com, male infertility specialists, National Directory of Male Infertility Physicians. ShadyGroveFertility.com, Shady Grove Fertility Center. Infertility Clinic and IVF Center with locations in Maryland, Virginia, and Washington, D.C. SSA-AGENCY.com, Surrogacy Specialists of America, LLC, find out about surrogate, gestational carrier, egg donor, embryo donation and related legal services from this agency with locations in Houston, Dallas, and Atlanta, GA. Andrology Journal websites. tandf.co.uk/journals/titles/01485016.html, Archives of Andrology. The journal publishes research papers, review articles, and short communications in the areas of reproduction, fertility regulation and infertility in the male. Andrologyjournal.org, Journal of Andrology, online version of the journal. AsiaAndro.com, Asian Journal of Andrology, an official publication of the Asian Society of Andrology founded in June 1999. BioLReprod.org, Biology of Reproduction, online version of the official journal of the Society for the Study of Reproduction. Elsevier.com/locate/fertiles fertility and sterility, an international journal for obstetricians, gynecologists, reproductive endocrinologists, urologists, basic scientists, and others who treat and investigate problems of infertility and human reproductive disorders. humrep.oxfordjournals.org, Human Reproduction. The journal features full-length, peer-reviewed papers reporting original research, clinical case histories, as well as opinions and debates on topical issues. humupd.oxfordjournals.org/rss/current.xml, Human Reproduction Update, RSS feed of current issue. humupd.oxfordjournals.org, Human Reproduction Update. journals.cambridge.org/action/display journal $GD=RMR, Reproductive Medicine Review, publishes up-to-date reviews of reproductive medicine, particularly in relation to scientific discoveries underpinning developments in clinical practice. molehr.oxfordjournals.org, Molecular Human Reproduction, the journal publishes articles on the molecular aspects of human reproductive physiology and pathology, endocrinology, andrology, gonadal function, gametogenesis, fertilization, embryo development, implantation, pregnancy, and contraception. Andrology organizations' websites. Andrology.org, International Society of Andrology, ISA, founded in 1981, has now grown to 40 member national and regional societies representing 10,000 members worldwide. Andrology.tripod.com, Society of Andrology, India, information about the society, the aims, and meetings. Andrologyaustralia.org, Andrology Australia, the Australian Centre of Excellence in Male Reproductive Health, which aims to enhance community and health professional knowledge in targeted areas of male reproductive health, offers information about the society. Andrologysociety.org, American Society of Andrology, non-profit scientific, literary and educational organization advancing the knowledge of male reproductive biology and medicine. ASRM.org, American Society of Reproductive Medicine. The ASRM is an organization devoted to advancing knowledge and expertise in reproductive medicine and biology, with a particular focus on infertility. BritishAndrology.org.uk, British Andrology Society, special interest group for scientists and clinicians working in the fields of human and mammalian reproduction with an interest in the male. CFAS.ca, Canadian Fertility and Andrology Society, opportunity to receive information, communicate and collaborate with colleagues across Canada and around the globe. Facebook.com/NAF, a webcom, Nordic Association for Andrology, works to inform and arrange education in andrology. ISOM.ch, International Society for the Study of the Aging Male, ISOM, information about the society and actual and past congresses. MEFS.org, Middle East Fertility Society, the only organization in the Middle East devoted exclusively to reproductive medicine. PCRSonline.org, Pacific Coast Reproductive Society, a voluntary, non-profit organization deeply rooted in the continuing education, CME, of professionals in reproductive medicine. SMRU.org, Society for Male Reproduction and Urology. The Society promotes the advancement of understanding of male reproductive physiology and management of male infertility by providing a forum for the dissemination of both basic and clinical research information and support of educational programs. Urology websites. verywellhealth.com/search?Q=urology. hcd2.bupa.co.uk/fact_sheets/html/terp.html, bupa having prostate surgery, terp, facts to help a man make an informed decision. mpuh.org, Muljibhai Patel Urological Hospital. MPUH is one of its kind in Asia and the first hospital in the country devoted entirely to nephrology and urology. BOSS.org.uk, British Association of Urological Surgeons, BOSS, professional organisation promoting high standards through fostering education, research, and clinical excellence. ESBU.org, European Society for Pediatric Urology, dedicated to the treatment of congenital abnormalities and diseases of the genito-urinary tract in children. WSUS.org, Washington State Urology Society, urologic care, education, and advocacy for patients and physicians. Find urology clinics. dmoz.odp.org/health/medicine/surgery/urology/clinics_and_practitioners/united_states. Urology journals. co-urology.com, Current Opinion in Urology, bi-monthly published review journal that aims to help clinicians and researchers keep up to date with information published in urology. JASN.org, Journal of the American Society of Nephrology, online journal specializing in diseases of the kidney. JRNjournal.org, Journal of Renal Nutrition, the official journal of the Council on Renal Nutrition of the National Kidney Foundation. JUrology.com, Journal of Urology.